I'm going to talk about a controversial topic that's about how a mammogram may harm you. So, this is a controversial topic, and first, I want to start off with a disclaimer. Cancer is terrible, and cancer is definitely killing many women today. But when you look at the facts of mammography, and that's basically what we're going to be talking about today as the real facts, there are controversial findings. You've probably been told by your friends, colleagues, other healthcare workers that you are a bad patient, you are a bad citizen, you are a bad person not taking care of their health if you have not gotten your mammogram. Just this week, I've been asked by several 30-year-old women, because it's breast cancer awareness month. I've been asked by several 30-year-old women whether they should get mammograms or not, and the data clearly suggests that they should not have a mammogram done unless there's significant genetic risk factors. So let's go through a few basic things. My name is Dr. Philip Oog, and we're going to be talking about the harms of mammography. So first of all, breast cancer is the most common non-skin cancer that we know in America. It is the most frequent cause of cancer death in women worldwide. It's actually number 2 in the United States. The majority of breast cancers are caught by an abnormal mammogram. The significant amount is actually brought to attention by the patient. So what does that mean? That means that the patient feels a lump or a nodule or has a concern about a nipple change or a skin change, and then they go and get a mammogram, whether it's early or on time, and then the mammogram detects the finding. So breast cancer mortality is down by 33% since the 1980s. That's a pretty good statistic. That says that we're overall in medicine doing a good job with breast cancer death. So down 33%. That means if you have breast cancer, you're 33% less likely to die than when you were in the 1980s. But it's not because of mammography or mammograms. That's what our studies say. So commonly when you see that number quoted and recited, as it is Breast Cancer Awareness Month, it does not necessarily mean it's because of mammograms. It's most likely because our surgical methods, chemotherapy and radiation, have gotten so much better than they were in the 1980s. We're really making tremendous leaps and bounds. And now there's a lot of natural things that you can do, and there's lots of data out there, like The Truth About Cancer, on what natural things you can do to reduce your cancer risks and improve your cancer outcomes. So if you have a genetic predisposition, meaning your mother had breast cancer, your sister had breast cancer, this video is not for you. Okay, you definitely need to get mammograms. You need to listen to your doctor's recommendations. You have to do the right things. Maybe even go as far as Angelina Jolie and having mastectomy before breast cancer starts. So for all of you people who are genetically predisposed to cancer, this is not for you. You can turn it off right now. So I don't want you to get offended when I talk about the normal population. So what I'm going to be talking about here is how to assess if you are a normal average risk or whether you are at higher risk, meaning based on genetics. And so if you're a normal risk or average risk, then the recommendations I will say for mammography is supported by the data. So I made some notes, so let's go through it. So the major risk factors for breast cancer, of course, this one always sounds silly, personal history of cancer. Okay, so if you have a personal history of cancer, that means you're genetically susceptible to cancer and you are outside of this average risk population. Number 2 is a family history of any of the female cancers, not just breast cancers. So breast, ovarian, cervical, vaginal, vulva, any of the other female cancers, then you are at higher risk for breast cancer as well. Of course, the genetic risk, like we just talked about with Angelina Jolie, the BRCA mutation that everybody knows about, but is actually extremely rare. Radiation therapy to the chest between the ages of 10 to 30. Now that kind of falls in the same lines of having a personal history of cancer. If you had radiation therapy to your chest, you probably had some sort of cancer. I don't know what we use radiation for these days besides cancer. So if you don't have any of those risk factors, then you're at average risk. Your average lifetime risk of developing breast cancer being 12.4%. That's a little high. That's a little spooky. There's a breast cancer risk assessment tool. The website is www.cancer.gov/BCRISK tool. So that's BC Breast Cancer Risk Tool. And you can go and plug in your numbers and how old you are, what family members have it and all that, and that can give you a basic risk if you're over the 12.4% average risk. So if you're at average risk, here are the current guidelines. Now, I'm passionate about this because most doctors are not having this discussion, and we'll talk about that in a minute. They're just signing the mammogram order, letting you go get your mammogram, insurance pays for it, so what's the big deal? The big deal is that you can be harmed by a test. Most people don't know that. So we'll talk about the harms in a minute. For now, the current guidelines, this is taken from the USPSTF website, that's the United States Preventive Services Task Force. That is a non-biased group that looks at the data and suggests how often we should be doing tests, why we should be doing them, or if we should be doing them at all. Their current recommendations are, if you are under 40, the experts do not suggest mammogram. They actually suggest against doing a mammogram because your ability to detect cancer and your risk of cancer is negligible, so you're going to get more harms done by getting a mammogram. Now, once again, if you have abnormal tissue or something like that, that's different. So age 40 to 49, experts do not recommend screening. Now, that's surprising because the majority of women that come to see me as a new patient, if they're in their 40s, many times they've already had a mammogram. So why are the experts, and this has been the recommendations for a while, why are the experts, the non-biased programs, recommending not doing it at 40 to 49, but doctors are still writing the order? The main reason is because it's a very legal society right now. Lawsuits are profound. Everyone's scared of breast cancer. There's tons of organizations that are promoting doing mammograms and getting screened. And I hate to say it, but medicine is a huge moneymaker. So look at who's funding these recommendations, and you might find out that it's a mammogram center that's suggesting you get your mammogram, or it's chemotherapy, or it's a drug company. There's a lot of money to be made in breast cancer. So I'm not saying that breast cancer isn't real, but you need to know your risks and you need to know if a test will harm you. So moving on to the next age group. This is the age group that actually has the benefit with mammograms. So starting at age 50 all the way up to 74, the recommendation for current mammography is a mammogram every other year. Currently, most of you women are being told that you need to go every year, otherwise you're a bad patient. That's not what the data suggests. The data suggests that we're not that great at detecting breast cancer with mammograms, and we should be doing them every other year. And we'll talk about harm in a second. If you're over 75 and you have a life expectancy of over 10 years, then you should continue every other year screening. Now, I realize everyone over 75 wants to live another 10 years, and it's hard to determine if you are going to live another 10 years. Physicians are notoriously terrible at estimating how much longer you're going to live, so that one is mainly left up to the patient. If you are over 75, you can decide whether you want to keep doing mammograms or not. And I will link to these actual guidelines on the internet so that you don't have to worry if I'm making this stuff up. Okay? So, harms. How can a test harm you? People often don't think about that because a test is just a test. Now, I'm not talking about harms, meaning when you go for a mammogram, they squish your breast and it's painful and that doesn't feel good. Yeah, that's a harm because it's uncomfortable, but that's not the harms I'm talking about. I'm talking about real lifetime risk and harm. Let's look at harms. For women in the age group 50 to 74, there was a large study that looked at multiple women. I think it was something like 100,000 women, and they basically came out to 8 deaths per 10,000 women were saved with mammography. So if 8 women were saved out of 10,000, that's not very many. And how many did we harm in the process? So let's talk about the numbers. There is a 50% risk of getting a false alarm with each mammogram that you do. That is a very high number, and the older you get, or if you're on hormone replacement, then those risks actually go up as far as getting a false alarm. Any test that has a false alarm rate of 50% is a bad test. Now, that's one example of how a mammogram can harm you, because if you're sitting on your couch and you get a phone call that says, hey, your mammogram was abnormal, you need to come back in and we need to retest it, your mind immediately goes to that one person you know that died young of breast cancer, and all of a sudden now you think you're going to die of breast cancer. Now, hopefully that's not true, and by the numbers, it's definitely not true. So if a test can cause you a harm, meaning you're worried you're going to have cancer, now you're going to lose some sleep, you're going to start spending your fortune to go on these lavish vacations, when ultimately your life may not have been changed at all, and that test just harmed you by that phone call. Now, hopefully you go for your repeat testing and it becomes negative and you don't have to worry about it, but still, that amount of worrying while you're waiting for your next exam and your results and all that, that's a harm. You're going to be worried you're about to die. So there was another study in 2009 that looked at 600,000 women, and their number that they came to conclusion with was that 1 death was avoided for every 2,000 women. So if we extrapolate that to 10,000, like we were just referencing to the other group, that's 5 deaths for every 10,000 women. That's not a lot. I don't even think I've seen 10,000 women in my entire practice. So the fact that we're promoting everyone to get breast cancer mammograms at all kinds of ages is kind of silly. Our data for benefit is just not there. So the the scariest part to this, so one death out of every 2,000 women is avoided because of screening, but 10 healthy women per 2,000 women. Let me say that again. 10 healthy women out of 2,000 women, for every 2,000 women, are overdiagnosed and overtreated for breast cancer that would have never affected their life, meaning they would have never known they had breast cancer. They would have died of something else, a heart attack, a stroke, one of the other major causes of death, getting hit by a bus. So our research says that only one woman out of 2,000 gets their life saved by mammogram screening, while 10 women get harmed. Okay, so when I say someone is treated, so these 10 women out of 2,000 that were treated, that means they got surgery, which means a mastectomy, many times both sides, and that's a harm. So if you were going to live the rest of your life without knowing you ever had breast cancer, and now they remove your breast, which is a significant identifying organ for a female and often relates a lot to their self-esteem and their self-image, that's a big deal. Number two, maybe you went even further than surgery. Maybe they told you to get chemotherapy. And if you've ever heard of anyone getting chemotherapy, your lifetime risk of other cancers actually goes up. And then radiation, gosh, there's tons of risks with radiation. Now, we've come a long way with making radiation more precise and less broad, and so it doesn't harm as many organs. But still, radiation nonetheless, for something that would not have changed your life, is a harm. So if you're going to go through a mammogram, you need to understand that there's a potential harm associated with doing this mammogram. If you were diagnosed with breast cancer and told that you need surgery, chemotherapy, and radiation, how do you know if you're the 10 healthy women or the one woman that will have their life saved? It's pretty hard once you get that news to say, I'm not going to do chemotherapy, radiation, or surgery, and I'm going to go against my doctor's advice and take my chances. That's scary. I don't think I can make that decision. I don't know if I could tell a loved one to make that decision, because once you're diagnosed with cancer, you think you're going to die and you're going to do anything and everything in your power to reverse that. And if that's surgery, radiation, and chemotherapy, you're most likely going to do it. So what I'm encouraging you to do is think about the risk before you just jump into a mammogram, because once you get in that medical spiral or that medical carousel and you get diagnosed with breast cancer, you will not remember that 10 healthy women were overdiagnosed and overtreated. The other issue that comes up with this, and this is controversial, even though it's pretty factual, with these data, it's gonna suggest that only one woman for every 2,000 women is saved. Now, the 10 women that were treated with chemotherapy, radiation, and surgery now believe they're cured of breast cancer. So they're going around parading, saying that they have improved their life expectancy because they were treated and early detected. And the research just does not support that. So how do the women know which life was saved and which one wasn't? There's no way to know. The only way we know is because when we do these large trials, we take two groups of women. We take one that undergoes testing and another group that doesn't do any testing at all. And then we compare the two. And when you compare the two, only one woman dies earlier if they don't do mammogram testing. Whereas 10 women get treated that didn't need to be treated because only one extra person died in this group. So that means they had to treat 11 people to save one out of 2,000. That's every 2,000 women. So that's a scary number. So once again, I'm going to just make a disclaimer that breast cancer is real and it really is affecting people, and I'm not trying to discount that, but you need to know your risks before you undergo a mammography. So there's some other things to discuss as far as concerns and risks with mammogram. So one thing that women often worry about is the radiation. So a mammogram is an x-ray, it is radiation. Our radiation levels as far as mammograms and x-rays in general have plummeted tremendously. So it's actually a very small dose of radiation. Whether that radiation matters because it's so close to the breast, I'd say that's controversial at best, but it makes sense that if you start at age 35 getting yearly mammograms, by the time you're 60, you've had a significant dose of radiation given to your breast. So that's another reason to only use mammograms as often as recommended. Another concern in this, I kind of briefly mentioned earlier, is the financial benefits to the medical system of early detection, surgery, chemotherapy, and radiation. I won't go into any more detail about that. There's another thing that's getting more common to do, and that's a thermogram. And so I often tell people that thermograms are an option for you, but they're not really proven. There's no good data suggesting that it's going to reduce your risk of dying of breast cancer. Part of the problem is that it detects cancer later, because a thermogram works by doing an infrared assessment of your breast, and many times they do the whole body. And basically the idea is that if you have a tumor or cancer in there, then it's going to be hotter and you're going to see that spot on the skin. That it hasn't been always true, or at least there's not good data to support that argument. So I tell women that they can do a thermogram because it's not radiation, but it may not decrease their risk at all. But if it helps them sleep a little bit at night, then that's worth doing. There's several centers all around the country, including some in Austin and San Antonio. A lot of people are asking about the other versions of testing other than mammograms, and so far to date, the best screening tool, even though it's not good, and we just talked about all the harms that could possibly happen, is that the best screening tool is mammograms. So there are other options as far as testing, but usually that's after the mammogram is done, and then you go on to the next thing. So ultrasounds are getting more popular because there's no radiation, they're pretty harmless, they're easy to do. But an ultrasound is better for diagnosis after you've had a mammogram. It's better at ruling out cancer than ruling in cancer, so we use it after the mammogram. There's also MRIs, which are getting more popular. MRIs are really expensive, so most likely you're going to do a mammogram and then an ultrasound, and if the radiologist needs it, then they'll suggest an MRI, or before surgery, chemo, radiation, something like that, you'll need an MRI. So be mindful of who's suggesting you to get a mammogram. Make sure who you're listening to. Are you listening to someone that's cured who may not have been potentially cured? Are you listening to someone who stands to profit off of mammograms? Know your risks and don't believe this guy. Go look it up for yourself. The United States Preventive Services Task Force has an official statement. As of this recording, the most recent one was in 2016, and they usually update it every couple years or so. But the current recommendation is mammograms every other year, starting at age 50, and consider stopping at 75. But if you feel like you're going to live over 10 years, then keep doing them every other year. So that's all I'm going to say about mammograms. Please feel free to leave any comments, like, or share this. I understand there will be some people that don't like this video and will probably have some negative things to say. Once again, I'm not saying that cancer is not real. I'm just saying that we are terrible at detecting it, and mammograms are not as great as they've been touted to be. So with that being said, the best thing you can do to reduce your risk of breast cancer is eating a plant-based whole foods diet, reducing your stress, and exercising regularly. Multiple studies have proved that that reduces your all-cause mortality by 70%. That's way better than any mammogram. So make sure you're eating healthy, exercising, and reducing your stress. Okay guys, hope this video helps answer some questions.